The gentleman has 25 minutes remaining.
Thank you. Perfect timing. Mr. Speaker Pro Tem, I'm going to try to do a run-through of a couple things here. I'm going to try to walk through some economics. Then I'm going to actually try to walk through some warnings that are in the documents that are around us that very few people seem to bother to read. And then I'm going to actually do some things that are hopeful, because I think sometimes I'm a bit dour and I don't do enough of this. So first off, look, August, Republicans, we're going to go out and tell the morality of people's taxes not going up next year, what we did in the reconciliation budget of incentives to invest in America, to build new plants of equipment, for working people to have some things to actually draw them back into the labor force, no tax on tips, no tax on overtime, some of these things. If you actually look at one of the reasons those things are in there, and we're actually starting to see some of the models of the economic side actually saying some very optimistic things of, we think this is going to change labor force participation, small changes. The left will actually sort of do a bit of schizophrenia of, you cut spending over here, but too much of this money is borrowed. I agree, it's too much is borrowed. I want to cut more spending. But then you attack us when we try to actually point out misalignment, bad acts. In fact, we have, what was the report that just came out a couple days ago? We found, what is it, 2.8 million of our brothers and sisters enrolled in subsidized ACA plans as well as Medicaid plans. We're not allowed, they don't want to talk about that because it sort of screws up their pitch when you actually walk through what we see in the math. We know the American people believe and understand the morality and the great economics of encouraging those that are able-bodied, able to work, to participate in society. And if anyone's a geek out there, it's probably 4 or 5 years old. University of Chicago, 4 of their PhD economists wrote a brilliant paper talking about if you actually ask people to participate in society, in the economy, to take a job, even if you give them welfare, government subsidies, because they have attachment to the economy, to work, that at the end of 10 years, those who actually had the work requirements actually end up much wealthier and off of government support. Because it's the morality of learning to get up, building attachment, learning skills, moving up in an organization. So, but somehow that I don't, and there was a time that was actually left ethos, the argument of work as moral, and somehow that left the Democratic Party. So let's walk through a couple things. I've used this board for months now. It'll probably be the last time I use it. Understand, baseline, over the next 10 years, according to the Congressional Budget Office, we're going to spend $86 trillion. Think of the screaming and gnashing of teeth and protests, so they're all ginned up. You cut, what is it, $800 billion from this and a little bit from a couple other things. It was less than 2% of that spending. Are you telling me that the left doesn't believe that if you're spending $86 trillion as your baseline spending, and understand, I'm going to show you some of the charts, how much of this is basically demographics. We got old. Our healthcare costs. I'm going to show you a couple charts here in a couple of moments that I really want folks to understand. But for the American people, when you see someone from the Democratic Party behind a microphone going, they cut spending, it's this off of a base of this. It's the lack of understanding. And look, one of the points that you keep trying to make over and over and over and over and over again was the Democrats' plan that they wanted to raise taxes on everyone, because that was automatic. That was coming at the end of this year. Your taxes were going up back to the pre-2017 tax reform. Everyone wants you to get, well, you shouldn't have extended the tax policy for the highest income. Okay, but that's a tiny, tiny portion of the total dollar amounts. And look, when they had control of everything, they didn't do it. But just from a point, and this is more for everyone to understand, particularly even staff. You see the blue here, non-defense, defense, every dime of that is borrowed. And I think this year we'll probably borrow, let's call it $400 billion of Medicare. So my best estimate, and we're going to actually hold a contest shortly to see who can guess the final borrowing for this year. And the economy's actually been pretty good. We're tracking, we think actually, customs receipts. Many of you think of it as tariffs. We may have another $70 billion on top of baseline. It's probably going to come at $2.2 trillion of borrowing this year. So this doesn't have the tax reform, many of those things much built into that base. But understand, in this country, how do I help folks understand? Here's where we're already at. And this will make sense in a little while. For every dollar we take in tax receipts, we spend $1.39. We spend $1.39 for every dollar we take in tax receipts. But if you saw that previous chart, you've noticed that only about 24 to 26% is in discretionary, what we really get to vote on. That's why you end up having to use what we call these reconciliation budgets. 1974 Budget Control Act allows us to move a bill if it has certain fiscal properties to it through the Senate without having to get 60 votes. It's all a dance to deal with the 60 votes. If we were actually a little more honest about math, maybe we wouldn't have to do this dance. And why this is important is I'm a little freaked out because this is the MedPAC report. And I know every member of Congress has read every word of it because it's really important. But there's a chart in here if you actually read the footnotes. Now look, for anyone who's paying attention, you know I'm trying to bring Medicare Advantage back where the incentives actually are about helping populations be healthier and not about risk scoring them that it's a concentration of illness, but the incentives that if populations are healthier, the plans can make more money. But inside here is also a great data point, Mr. Speaker. This year we're going to spend, let's call it $1 trillion on Medicare. How many of you would guess what we're going to spend in 7 years? The model in here says in 7 years, we go from $1 trillion a year on Medicare to $2 trillion. We double Medicare spending in 7 years. Now, part of that is demographics. Starting in functionally 30 years ago, we started having a lot fewer children. So today, if we took today and stepped back 20 years ago, we had about 35 million of our brothers and sisters who were 65 30 years ago. Today, we're approaching about 70 million of our brothers and sisters who are 65 and up, so more than double. Go back 20 years ago, the number of 18-year-olds we have is pretty much the same as the number of 18-year-olds we have today. And next year, the number of 18-year-olds goes down, and the year after that, it goes down, and the year after that, it goes down. Is that Republican or Democrat, or is it just demographics? It's a little hard to campaign on that. It's a little hard to attack the other side. But the fact of the matter is, if we all read our data, we don't have a choice. This is the Social Security Medicare Actuary Report. Another thing I know every member here has actually read. 7 years from now, Medicare Part A trust fund, which is about 38% of Medicare spending. The rest comes out of the general fund, and members' participation, I think, is about 15%, the fees they pay. But that 38%, that trust fund is gone in 7 years. meaning hospitals, surgery centers, everyone else, 11% cut. But I know we're all going to talk and work about how we're going to revolutionize the cost of healthcare, except one of the classic problems around here, Mr. Speaker, is for some reason on the left, and many of us on the right, we talk about healthcare as a finance problem. It's the ACA was a finance bill. It's who had to pay, who got subsidized. Medicare for All is a finance bill. I would argue the Republican alternative from a few years ago was a finance bill. It had a little better actuarial curve, but it was a finance bill. Who got subsidized, who has to pay? I beg of our brothers and sisters around here, open up your brain. We live in a time of miracles. We're going to have some conversation about how do you change the view of healthcare. It's what we pay. Can we change the cost by doing it better, faster, cheaper with technology, our brothers and sisters being healthier? Because if we don't, we have problems like it's on this chart. Today, 16% of all tax receipts go just to interest. In 9 budget years, actually 9 years straight up, in 9 years, 30% of all U.S. tax receipts go just to interest. And heaven forbid, if we had a 1-point movement in interest rates, my math is 45% of all tax receipts would go to interest. So when you see people come behind these microphones, how many people are saying, hey, how do we convince the bond markets? The bond markets are basically on the edge of running this country now, because when you borrow $6 billion a day, next year I think we borrow $6.5, maybe $7 billion a day. In 9 years, we're over $10 billion a day. Let's see, if we're 6, that's what, $72,000 a second. And some of the crazy articles, because I have this aggregator on my news that basically a couple left-wing economists saying, borrowing doesn't matter. People are always willing to buy U.S. debt. Okay, let's pretend these left-wing economists are right. We can continue to borrow and borrow and borrow. They purposely sort of forget the punchline. Okay, let's say we could borrow forever. At what point is there no more services, purchases, government helping our brothers and sisters, because it's all covering the interest costs on the bonds? So let's say you're, I think, a little insane, but you believe we can just borrow forever. You're a monetarist, but even the fragility in the monetarists you saw in the previous few years of inflation, that their model didn't work. But additional to that, we're going to pay the interest. So in 9 years, baseline under a favorable interest rate model, 30% of all U.S. tax receipts go to interest, and heaven forbid, if interest rates were to come up 1%, because we have to, this year, or this coming year, I think we're going to refinance $11 trillion. The year after that, I think it's 13, because we stay so short on the financing term, and we sell short-term debt instead of longer-term debt, because it turns out there's not as big an appetite. So we're in this world where 9 budget years, $10 billion a day. So let's actually, I'm just going to run through a number of these things fairly quickly, just to sort of get a point. National health expenditures as a percentage of GDP. This will make sense in a moment. In 2033, so functionally, 8 years from now, over 20% of the economy will just be healthcare. Why? The Joint Economic Committee 2 years ago wrote a report that I thought I was going to get the crap kicked out of me, but we spent months and months and months grabbing every bit of literature and said, can someone tell me what obesity costs America, what it costs society, what it costs family formation, what it costs. We came up with a number, this is 2 years ago, of 9.1 trillion additional health care costs. And we had some mortality statistics, the number of multi-chronic conditions, the misery out there. Now, what is fascinating is we have some articles right now that talking about that we may have actually hit something crazy, and it's an odd way to phrase it, but it is what the researchers, we may have already hit what we call peak obesity. So when we published the report 2 years ago, we still had about 4 or 5 more years of growth of obesity. In some states, actually approaching 50% of their population being technically obese under the BMI calculations. Looks like in the last 12 months, we may have started to bend the curve. We're trying to recalculate, is this a sign of incredible hope that we know so much misery in our society? Because there's a brilliant paper from about 7 years ago saying leading contributor to income inequality in America, turns out, isn't education, turns out it's health. And if you think about it, the cascade of the cost of someone with severe diabetes, when we already know diabetes is 33% of U.S. healthcare, what if things like this actually could help our brothers and sisters? Is this Republican or Democrat? It's just good policy. It's just always been uncomfortable to talk about. And maybe the society is starting to open up saying, hey, maybe a healthier society actually is a really good, really moral thing. So look, as we walk through these, I want to come back and sort of hit a punchline here. These charts have been available to us for years. The curve keeps getting steeper. So when you have someone say, I'm a protector of Medicare, great, I'm with you. It's an earned benefit. We made a societal promise. Are you telling the truth about its financing? Oh, David, we can't do that. Someone will say something mean about us. So what also? In 7 years, also is empty. The Social Security Trust Fund. I'm sure you all dove into the Social Security Medicare Actuary Report and saw the point in there where it says in 2033, actually we think it's 2032, our brothers and sisters on Social Security take a 24% cut. Our model says we double senior poverty in America. Absolutely immoral. But have you also read the papers of the scale of tax hikes, of policy? Now, is the left offering to work with those of us on the right who are willing to step on the third rail and do the moral thing to actually take on these? Hell no. I've talked to so many people who are in Ways and Means and other things with me who basically look at me in terror and run out of the room because the political consultants care more about the power of the politics than the fact that in 7 years, Medicare is $2 trillion a year. In 7 years, the Medicare Trust Fund is empty. In 7 years, the Social Security Trust Fund is empty. And one of the rough numbers we had is the first full year, just if you wanted to backfill that shortfall in Social Security, is $618 billion. So basically, what is that? 2/3 of what the entire defense budget is. There's a lack of understanding of the scale of almost the dystopianism that comes from what happens when these trust funds are empty. Hey, Mr. Speaker Pro Tem, may I make an inquiry in how many minutes I have left?
The gentleman has 6 minutes remaining.
Thank you, Mr. Speaker. I'll learn to talk faster, but the poor person trying to take my words down, I apologize too. I can sometimes. I'm going to skip over some of the other charts. You get the punchline. In the next decade, the vast majority of debt is driven by interest, healthcare costs, and we're often very uncomfortable to talk about it. So let's actually talk about things that are great, that if we would get policy right, can lower that healthcare cost, not just argument about who gets subsidized, who gets financed, be really good for society, really good for the budget. So you all saw the Economist article last couple days talking about the miracle of how much cancer, the statistical benefits we're having on the number of cures, particularly lung cancer, blood cancers, and their model that we are on the cusp of having continued major breakthroughs. You all saw this article a couple of days ago about a Microsoft platform. I didn't even know they were specializing in this. And what was stunning about the data sets they had in here, AI system diagnosed patients 4 times more accurately than a human doctor. Now, I just upset some of my brothers and sisters in the Doc Caucus, but the data is the data. Should we, Mr. Speaker, legalize technology? If I have something I can blow into called a breath biopsy, if it's statistically as accurate or more accurate than a human and knows what I have, should it be allowed to prescribe? Uncomfortable, but it would help crash the cost of health care. It would actually help us move some of the facts that we have shortage of medical professionals. We're on the cusp of these things. Matter of fact, many of these things, like that technology, has been around for 5 years, except it's functioning illegal. We don't reimburse it and we don't allow it to prescribe. We are on the cusp. A few minutes ago, an hour ago, Altman, OpenAI, was down the hallway. He and I had a few minutes of conversation about a new healthcare stack that's going to go public in about a month. And he seemed incredibly optimistic that its accuracy will be off the charts. Should we legalize the use of technology to help our society be healthier? Should we allow it to prescribe? It's uncomfortable because this place is a protection racket. You've got to understand, Congress is mostly about one thing. It's about money. And the left pretends it isn't, the right pretends it's about money. And when you start to say, hey, maybe we could use technology as a competition to help our brothers and sisters be healthier and therefore change the cost of health care, someone's going to look at you and say, but I make money on that. You're going to now have me compete against a data system that's more accurate than I am. But over and over, new Apple Watch AI model can reveal hidden health conditions. Here's a couple of the things I've been most interested in last couple of years. Great article. I have a huge one. I did a whole speech on it a couple of years ago. AI discovered a whole new category of antibiotics. So you remember we were all panic-stricken that we had diseases, bacterial infections that we didn't have antibiotics for. The antibiotics weren't working. And AI designed a whole new category of antibiotics that in the literature said it would have taken humans 20 years to develop. Instead of being afraid of the technology, maybe we get our heads straightened up saying, in a society where we have a shortage of young people, our baby boomers like me with gray hair, we're getting older, we're going to consume a lot more health care. Can we embrace the technology? And that technology lets us free when you start to realize the things that are going on. We just had a doctor, a radiologist in our office, walking us through a statistical abstract on breast cancers and the scans and showing that his AI platform is remarkably more accurate, cheaper, faster, and more accurate. Why wouldn't we embrace that, except we don't reimburse it? Because the barriers to entry here are protection rackets saying we're not fighting for what's the fastest, bestest, cheapest. We're often here because we know our incumbency. And look, we really are on the edge of miracles. How do I get the left, the right, to understand the math is the math? Demographics are the primary driver of U.S. sovereign debt. Now, it's hard to campaign against the other side on that, but yeah, maybe we could take a couple months off and actually do good quality policy and legalize properly vetted, properly certified AI to prescribe. The wearables. This August, I'm going to do an experiment with this Oura Ring, and I'm buying some Dexcoms to manage my... Have you all seen the app where you can take a picture of your food and it calculates its glucose and its calories? How do we create the incentives? Maybe we should look at the ACA, and instead of just smoking in 3 age categories, we could add a 5th category that's an incentive for our brothers and sisters that if you manage your health, 16% of U.S. healthcare is people not taking their drugs for their hypertension, for their statin. 16% is over $600 billion a year. There are solutions. We can make a difference. Embrace the technology, change the costs, have a healthier society, and it's the most powerful thing we can do for U.S. sovereign debt. With that, Mr. Speaker, I yield back.